My name is Brandy Butcher, and I'm doing a video for American Sentinel University, the ADN to BSN program for SIM 440, Component 5 Evidence-Based Practice. So I chose to do COPD, which is chronic obstructive pulmonary disorder. Some of the articles that I had read, or journals, say that this is now up to the third leading cause of mortality and morbidity in the United States. Some of the best practices, according to the NCBI for COPD, include spirometric diagnosis. It's essential to come up with the proper diagnosis so the treatment can be started. Smoking cessation, because obviously this is going to be a chronic lung issue, and smoking is only going to restrict the lung capacity. So if you could get them to quit smoking, it would help with their illness. They need to stay up to date on all vaccines. This would include the pneumonia vaccine, the flu vaccine, and more recently the COVID vaccine. And then pharmacological therapies, which would be like bronchodilators, steroids, and then just regular maintenance medicines. And then early recognition and treatment of exacerbations. So you want to be able to start antibiotics, make sure that they have rescue inhalers, increase steroids or do IV steroids to get that under control quicker. And then pulmonary rehab, just so that way they could try to improve the functionality of their lungs bilaterally. The goal of the care would be to be able to make sure these patients could take care of themselves at home, and that they knew what they could do to prevent having an exacerbation, and to make sure that they understand the importance of staying on their regimen, as well as not smoking and staying up to date on all their current vaccines. As far as the evaluation of guidelines, in my research I found that Global Initiative for COPD, or GOLD, basically created a panel initially when COPD came about that included a diverse group of healthcare professionals that range from respiratory medicine, socioeconomics, public health, and educators to come up with guidelines and evidence-based practices to treat and care for these patients. It says that they are reviewed at least every year, but they're at least reviewed every year, but they could be done more frequently if needed. According to the NCBI, clinical pathways aim to guide evidence-based practice and improve interaction between health services. An evidence-based practice, or the clinical pathways, would be initiated by case management. And then this will be a pathway that's going to be able to guide the plan of treatment and care for this individual. It's going to be individualized. It's not going to be a one-size-fits-all. You're not going to treat, a 50-year-old the same as you're going to treat the 80-year-old. So it's going to be more individualized to each patient. It will be continually updated based on best practices, as well as based on the patient's condition. All caregivers that are participating in the patient's care will be able to have access to this clinical pathway and be able to guide for the treatment and just have the best practice for these patients.